let's get you caught up on the coronavirus developments. The surge of coronavirus cases is arriving in Indiana, and it isn't expected to peak for another couple weeks still. Right now, our state hit another somber milestone. Our death toll has officially passed 100. Last week at this time, we were only at 24. So what does this mean? Right now, Indiana has the 15th highest number of cases in the U.S. Nearly 3,500 Hoosiers have the virus. But this is much lower compared to places like New York, which has more than 100,000 cases. That brings us to the CDC's new guidelines. The new recommendations suggest every American wear non-medical cloth masks in public where social distancing is difficult, say like at a store. But you don't have to wear a mask if you don't want to. It's not mandatory. Their main concern is wearing these masks could bring a false sense of security and lead to less social distancing. Doctors are reminding people that masks are an added layer of protection, but not enough to slow the spread by themselves.
There were some big takeaways from the governor's latest coronavirus briefing, so let's take you through those this morning. He is extending the state's stay-at-home order for 2 more weeks. The National Guard says they'll scout places this weekend that could be turned into alternate care facilities in areas where we see a surge in the number of patients. And the state just saw its biggest jump in the number of coronavirus deaths in 24 hours, bringing the total to 102 people. He also brought up the toll this pandemic is taking on our mental health. If you're struggling right now, just know that you are not alone. It's a lot to handle. It's normal to have anxiety or be depressed about what's going on, but there is some help out there for you. You can always call 211 or ask about your insurance. Ask your insurance about what's called teletherapy. It's therapy online, essentially. A doctor actually hosted a session during the governor's briefing. We've posted that video on our website, WTHR.com.
What's happening in New York right now is devastating. More than 3,000 people have died, and hospitals are struggling to help the spiking number of patients. Now, our Emily Longnecker introduces us to a nurse from right here in Indiana, driving to the epicenter to help.
Benita Norman's about to set out on the cross-country trip of a lifetime.
We're not going on vacations.
Not at all. Benita's a traveling nurse, and any day now, she's going to get called to the Big Apple to work at a hospital in Queens. She knows she's taking a risk, but nursing is what she's called to do. She never imagined, though, she'd be doing it in the middle of a global pandemic.
I am aware that there's a chance that I may not come back home. But at the same time, somebody has to go help.
Benita decided that somebody should be her. She hopes New Yorkers will return the favor when it's Indiana's time of greatest need.
I would like to believe that there would be several New Yorkers that would be willing to come and help us when our numbers start to rise and when we can't manage this on our own anymore.
Her husband doesn't like the idea, but supports her desire to go.
He knew when he married me that I wanted to go to nursing school and be a nurse, and he has said he knows that this is something that I need to do.
Benita plans to work with patients who, in addition to possibly having COVID-19, will also have some kind of mental illness.
This is why I went to school. I wanted to help people that were in crisis, and that's not always going to be at home.
Benita's not just bringing her nursing skills to New York, she's bringing supplies too, items that can be made into protective gear. She expects it to be in short supply, if any is left at all.
So we can use things like the foam.
And while she recognizes she'll be on the front lines of this fight,
these shields came from the Dollar Tree.
Benita says the time has come for everyone.
They can be cleaned up
to join in at some level.
And then slide the earpieces on the glasses. Patient care isn't just being on the front lines. Patient care starts at home. With you staying at home, you can protect your neighbors. You can keep from spreading this virus.
For Benita, there is no staying at home. She could if she wanted, but that's not what her heart is telling her to do.
If for some reason I didn't come back home after this contract, this is what I chose to do with my life for the lives of others.